Family League of Baltimore is a 501c3 nonprofit organization and the designated local management board for the City of Baltimore under the Governor's Office of Crime Prevention, Youth, and Victim Services. Its mission is to serve as an architect of change in Baltimore by promoting data-driven, collaborative initiatives and aligning resources to create lasting outcomes for children, families, and communities. Its work is guided by the 8 child well-being results areas identified by the state of Maryland. As a local management board, Family League is charged with supporting a local interagency service delivery system for children, youth, and families. It occupies a unique role in the city, serving as a neutral convener of cross-sector partners guided by the vision of a Baltimore where every child grows up in a family and community that thrives. Family League manages and deploys resources from local, state, and federal government, leveraged against philanthropic supports to fund effective social change. In this role, Family League is required to measure the needs of the city regarding current problems, community strengths, and available programs, services, and resources. The organization last conducted a needs assessment in June 2014. The report was responsive to Maryland's Child Results for Well-Being report. In the same vein as the earlier report, the current Community Health Needs Assessment is the culmination of work by Morgan State University School of Community Health and Policy. The work is undertaken to provide an expanded assessment of the needs of the areas served by Family League. It provides Baltimore's historical context as a backdrop for understanding and responding to the accountability areas as designated by the Governor's Office of Crime Prevention, Youth, and Victim Services. Social determinants are the conditions in which people live, work, and engage in recreation that have an impact on health. More specifically, it is the understanding that well-being is a combination of individual, familial, societal, and place-based contributors. Framing under social determinants is especially relevant in Baltimore, where health status of residents varies considerably by race, ethnicity, income, and neighborhood. Unfortunately, Baltimore City has a well-documented history of place-based practices that help produce these inequities. The city has often been a destination point for those seeking refuge. Europeans during World War I and World War II, African Americans during the Great Migration, and Central Americans during the first part of the 21st century. Due to this mixture of peoples and cultures, Baltimore is a city rich in culture, cuisine, unique neighborhoods, and diverse identity. However, the city is also characterized by deep racial and spatial divides. Baltimore's hypersegregation by race results in a striking lack of spatial equity and is readily apparent when viewing the racial composition of Baltimore. In fact, Baltimore is a Category 5 hypersegregated city. This classification indicates that in Baltimore, African Americans are highly segregated across 5 dimensions simultaneously, ranking it as one of the most racially segregated metropolitan areas in America. Predatory and discriminatory real estate practices dating back to 1910, including racial zoning, racially restrictive covenants, and a real estate conspiracy against Black home buyers. In 1937, the City of Baltimore assisted the federal government's Homeowners Loan Corporation in creating the Residential Security Map that codified redlining, a practice where terms and availability for bank loans for the purchase of homes were systemically denied based on the race of people living in the neighborhood in Baltimore. Over time, the cumulative effects of these policies and practices created what has been referred to by Dr. Lawrence Brown as the black butterfly and the white L. Communities in the city's black butterfly, where African Americans largely live, stretching from East and West Baltimore, are to this day characterized by structural disadvantages. In the 1990s and early 2000s, homeowners in the black butterfly were also deeply damaged by subprime lending, which further stripped the wealth of black home buyers as thousands of recipients lost their homes to mortgage foreclosures. Evidence of the current inequity in communities has been indexed and mapped for Baltimore City as represented in the Equity Power Map. The power mapping color scheme shows the red color as representing power at the lower end of the distribution, and green colors show power at the upper levels of the distribution. Yellow are communities somewhere in the middle. Meanwhile, the city's white L neighborhoods, where white Baltimoreans largely live, running from the city's center from north to south along St. Paul and Charles Streets to the Inner Harbor, and then moving east along Eastern Avenue, fare considerably better along all key indicators for health, education, and community well-being. Now, why does that matter? It matters because socially determined inequities have substantial impact in influencing the lives of the individuals and families who reside in these communities. The empirical evidence for structural influences on population health has been well substantiated. In fulfilling its mission, Family League recognizes this context and requires consideration of the systemic challenges impacting its efforts to improve health and to eliminate the disparities in its mandated areas of accountability. Working in tandem with the inequity is the reality that many of the children and families living in hyper-segregated communities have been marginalized and disempowered, with their voices not always being heard. The knowledge of the lived experiences of families across the city, but especially in these red line communities, is critical to both understanding the key issues and fashioning effective and efficient supporting programs and structures to achieve desired outcomes for family, children, and communities. The fulfilling of Family League's vision and mission would be made more likely by hearing these voices. Now, the disparities and inequities that have been noted should not lead to a perception and presumption of children and families as helpless victims of circumstance or communities. Rather, the background is presented to provide a full picture of the context in which Family League will be planning its future agenda. Consequently, it is the intent of this work to provide opportunity for a full assessment designed to capture snapshots through community focus groups and key informant interviews to understand both the strengths and challenges for communities. From an equity perspective, the majority of communities selected showed clear patterns of racial inequity that would align with Baltimore City's history of structural racism through redlining. These communities, Sandtown, Winchester, Harlem Park, Penn North Reservoir Hill, Southwest Baltimore, Madison East End, and Greenmont in the main had statistics in the key areas that were less reflective of child well-being than Baltimore City overall. Greater Roland Park community was included in the analysis as a reference community due to it being a predominantly non-African American community and being located in a red line advantaged area. It has statistics that were consistently outperforming Baltimore City and all other communities by considerable numbers. The inequitable non-random clustering had both racial as well as geographical facets, east side, west side dichotomy. There were within and between neighborhood differences and some communities. West Baltimore predominantly that show evidence of meeting or exceeding Baltimore City, notably for the babies born healthy result. It would be difficult to effectively communicate the totality of the qualitative findings simply by restating the data observations. Therefore, the overall summary of the results findings is designed to encapsulate and highlight the information that is deemed most relevant for Family League strategic planning purposes. As the report was framed around the issue of equity, an equity lens is applied to reviewing the data. Existence of equity would predict that well-being indicators should be present in a fairly random pattern. The presence of clustering of indicators in a non-positive direction would indicate that inequity, not equity, may be at play. This would be consistent with the historical background presented in the opening portion of the report. This table represents a summary of the findings from the quantitative data organized by results area. The legend for the table defines the meanings of the symbols used. In alignment with the equity lens, the statistics for each community are placed in context relative to Baltimore City data. The decision-making for assigning an assessment value for each indicator by community was based on data across all years. The overall trend data refers to discernible patterns for Baltimore City statistics only covering the last 3 years. This was intended to align with the strategic planning cycle and Family League's role as the Baltimore City Local Management Board. The decision for the arrow directionality was based on the percent of indicators that fell discernibly above or below Baltimore City. Where no pattern was clear or the number of under versus over data points were equal, the bidirectional arrow was applied. Overall, from an equity perspective, the data tend to support the premise of inequity, notable in communities based in East Baltimore, that being Greenmount East and Madison East End, though clustering of inequity in West Baltimore communities was also clear, but not as consistent. The one community that has better outcomes than Baltimore City and all other communities is Greater Roland Park, Poplar Hill, the one community within the white L. As these are only a small subset of the 55 statistical areas in Baltimore and about 11% of the total population, the findings should not be overgeneralized. However, the patterns that emerge may have implications for communities with similar demographics. Given the within and between community variation for several indicators, it is clear that the drivers of these outcomes are probably many. Assessment would be more precise with the inclusion of more contextual information. And so how are we doing? The trends for the last 3 years of data indicate babies being born healthy for 2/3 of the state's key indicators, and youth employment readiness have been moving in the right direction. While school completion, family economic stability, and school readiness have been relatively stable over time, healthy children, community safety, and selected school success measures, including absenteeism and 3rd grade reading, have not been trending positively. The Community Voices section of this report reflects focus groups held in communities at various sites, as well as the key informant interviews associated with service providers who work closely with communities. Where there are comments or concluding statements, they are specifically noted. These were guided discussions, but in the interest of presenting a cohesive narrative, the communications are arranged topically to facilitate presentation. The following perspectives emerge from across the sections that may have implications for understanding community strengths, challenges, and needs. Crime, violence, and safety. is a major and across-the-board challenge for communities. Experiencing, witnessing, or having knowledge of homicide and gun violence are significant problems that have a considerable effect on children's schooling, including learning and attendance, mental health, and the ability for residents to create community spaces. Access to safe, affordable, and healthy housing is a consistently pressing concern, whether the issue is access to home ownership or dealing with the issues associated with rental properties. Preparation for employment, availability of employment within the community, and vocational skills training for youth and adults were all raised in conversations. Transportation was a multifaceted issue woven throughout discussions. Affordability, accessibility, efficiency, safety, and quality of transportation were all noted as specific concerns with the ability to impact success in school, employment, and access to services. Schools were seen as both assets and an area of challenge. Communities applauded existing opportunities for after-school programs and the value of education, but these were overshadowed by concerns with school safety, which are extensive enough to disrupt school attendance. The financial infrastructure in vulnerable communities, specifically financial literacy, lack of bank accounts, and access to institutions and capital, appear to be an area of significant challenge. Community members do not generally view the government without specificity as an advocate or supporter of community well-being. The voices among several of the sessions expressed the feeling of being unfairly treated and viewed by the rest of the city, whether it be benign or intentional neglect or purposeful destruction, with communities only being known for the bad things and never for the good. As one person put it, Cherry Hill never gets to shine. Woven throughout the sessions were references to family-focused needs with culturally specific context. Parents need supports like parenting classes, job opportunity, and affordable daycare. Activities for youths, especially boys, and activities for men in the community to increase male involvement. The focus groups produced many recommendations on what was needed to help support and strengthen communities. Those included treatment centers, job, employment, and career opportunities, children and youth programming, invested people, including mentors, advocates, and government officials, family support, community spaces, improved policing, and physical improvements. Based on the quantitative findings and the goals as set by the Governor's Office of Crime Prevention, Youth, and Victim Services, the commitments of Family League, and most importantly, the voices of the community, the following recommendations are highlighted. The 4 areas that are currently prioritized for Family League align with the needs and challenges identified through the Community Health Needs Assessment. The recommendation would be to continue to prioritize these domains with review of the strategic activities aligned with them. Community variation may persist and warrant specific strategic consideration of how programs and resources are distributed, as well as consideration of the degree and nature of accessing these resources. Transportation and community preferences for accessing resources will need to be considered, as moving out of community is not always considered a wise and safe strategy. Family League should consider making an effort as a neutral partner to promote needed coordinating and collaborating structures to support the outcome that child and family resources made available through public and private sectors are effectively and efficiently developed and distributed across the city. Several of the organization leads raise this as their big picture challenge, given grant funding constraints and political shifts. Structural issues and concerns persist in community. While Family League supports programs that focus on children and youth, it will need to consider partnered relationships that concurrently address structural concerns, including transportation, safety, and housing. Consideration of programming for families of children beyond elementary age may be warranted, as issues of parental struggles around employment and behavioral health were fairly frequently noted. The context and correlates of the indicators being tracked bear further in-depth study to determine their impact. Consider the role of structural racism, family mobility, gentrification, targeted programming, and policy that may impact these outcomes. An evaluation framework that can allow for data gathering and analysis of multiple levels of data would strengthen the empirical basis for decision making. Data gathering gaps may also be considered. While it is a sensitive issue to collect some neighborhood level data, because of the history of redlining and the current reality of the black butterfly and white L, understanding the impact of Family League interventions may warrant collection of community level data beyond specific targeted programmatic outcomes and undertaking evaluation. This would certainly be an area where partnership would be valuable. The input of community remains relevant. Family League's structure provides an opportunity for this input, but as an organization, it may want to consider that even more avenues for community voice and influence on programmatic decisions may further enhance quality. Communication regarding this report and other critical findings should continue to be a two-way street. And finally, Family League may want to consider a mechanism to support adaptive village practices. This term has been created to reflect on the stories heard in focus groups about community residents creating healthy spaces for children and community without benefit of a formalized organizational structure. This means looking to fund small-scale grants that are directed to specific communities and community gatekeepers who may be creating innovative projects that would benefit greatly from infusion of funds. A little could go a long way and have many supportive rippling effects. With this opportunity should also come a chance for communities who choose to do so to tell their own stories and celebrate their strengths unfiltered by others. Family League thanks the Bainham Family Foundation and the Goldsecker Foundation, as well as the input of community members from across the city and our entire staff for making this community health needs assessment possible. To view the full community health needs assessment, visit transformation2020.familyleague.org.